Hey everyone, Jack here. We're all deep in lockdown again, so we're trying to change things up, be creative and add a little fun to our days with the filming of these videos. It's great to see everyone back online for video number 2 of the video series Xiel's Opinion On. In the first video we focused on radiotherapy. In this second video now we're going to concentrate on the field of nuclear medicine. I'm delighted to introduce my colleague Niall Goldie, who will share his thoughts on the world of nuclear medicine and also detail what solutions Xiel can provide to support you in line with these evolving technologies. Enjoy.
Thank you for that introduction, Jack. It's now my turn to give my opinion on nuclear medicine, where we're at the moment and where we might be going in the next few years. So I don't claim to be an expert, and what I say you might think is way off the mark. But that's the whole point of this series of videos. We give our thoughts. Maybe you can leave us a comment, let us know what you think, and maybe we could discuss it at a future conference or something like that. First, I'd like to say a brief word about the one thing that's affecting all departments, and us really, and that's obviously COVID-19. I mean, we're in lockdown again, that's why I'm doing this video from my front room. But it seems this time everything it's a little bit different. There's enough PPE, there's better patient planning through departments, and it seems that they're trying to keep as normal as possible. Hopefully, we'll be able to see each other again in 2021. Theranostics is the obvious buzzword in nuclear medicine at the moment. There's numerous new traces being simultaneously investigated. And of course, PSMA is also a really hot topic. Although gallium-68 is currently restricted to a few centres, with there so many PSMA kits now in clinical trials, will this keep demand for gallium generators high? Opposing this, it looks as though there's a steady supply of F-18 PSMA reaching pretty much all corners of the country. What will end up winning out? Is there room for both?
Let's look more closely at the status of PSMA in the UK. As previously mentioned in the video, access to PET PSMA is very limited for both gallium-68 and F-18 tracers. Many hospitals still only have access to choline, which has been shown to be inferior to PET PSMA in numerous peer-reviewed journals. In addition to this, capacity and access to PET scanners is also limited, resulting in patients who are usually older having to travel long distances. Furthermore, the number of referrals for other PET tracers such as FDG is continually increasing, meaning there simply will not be enough PET capacity for a long time. Currently, NHS England has agreed to reimburse F-18 PSMA at select centres, but only temporarily and only for specific indications such as very low PSA biochemical recurrence, further limiting prostate cancer patients' access to the gold standard of imaging. Beyond this, the demand for PSMA is only going to increase. Currently, many men rely on basic imaging with CT and bone scanning such as MDP for both staging and restaging. However, a seminal study by Prof. Hoffman et al. Demonstrated that there is a cohort of men with apparently localized prostate cancer who are at high risk of developing recurrence despite receiving timely and effective primary therapy. Regardless of whether or not these men undergo surgery or radiotherapy as primary treatment, up to 50% have biochemical recurrence, with a subsequently increased risk of metastases. A key reason for these high failure rates is that conventional imaging does not detect metastatic disease ab initio, and a local treatment is therefore destined to be ineffective. Accordingly, improved staging might enable better tailored treatments and improve outcomes in these high-risk men. So what are the potential solutions? It will be hard to increase the capacity of both PET PSMA tracers and PET scanners in line with increased demand. So should we be looking at SPECT? Technetium PSMA has recently been given approval by the MHRA to import for unlicensed use, and some UK physicians have already received RSAC approval. Technetium PSMA is the same PSMA small molecule but could be available in all nuclear medicine departments by using the existing radiopharmacy network to meet the unmatched demand of PSMA imaging.
At Xiel, we're very interested in FAPI and seeing where that goes. Regarding therapies, there's long been use of beta emitters in the UK, and the approval of lutetium dotatate was an important milestone for the industry, and that's really focused Big Pharma on the potential of radioligand therapy. We already have Novartis now in this space. Will we see more of these industry giants joining? Right, we're all waiting the results of the Vision trial, which will determine where we get lutetium PSMA in this country. But then what's next? Will we see more alpha emitters used? Might we see tracers like actinium more widespread? How does Xiel fit into this? We're currently partnered with Rotop, supplying their wide range of diagnostic cold kits. There's a few things in the pipeline that we're very excited about. We also work with Eckert and Ziegler, supplying their wide range of radiochemistry and synthesis equipment. If you have any interest in developing new tracers or translating that into an automated process, get in touch, we'd be happy to help. Outside of these two, Xiel have a strong track record of bringing innovative products to market, and obviously we continue to do so watch this space. Thanks for watching.